morning again, everyone, and happy Sunday. I know some of you are having the sniffles. We're going to talk about something related to the sniffles this morning. Don't diagnose yourself, though. Please don't do that. But I just want to bring in light to you. Lately, we've had a rise in walking pneumonia, especially among children. So just going to go over that a little bit today. And if you're having any of these symptoms, I will implore you to get yourself checked. So what is walking pneumonia? It is a mild form of pneumonia. It's a lung infection that causes your airways to swell, the air sacs in your lungs to fill with mucus and other fluids, a high fever, and a cough with mucus. If you have walking pneumonia, you may feel well enough to walk around and carry out daily tasks without realizing you have it. Walking pneumonia is the common term for atypical pneumonia. Walking pneumonia is different from regular pneumonia. The main difference between walking pneumonia and regular pneumonia are that walking pneumonia is usually milder and it usually doesn't require bed rest or hospitalization. Notice I say it usually doesn't, but sometimes it does. Walking pneumonia may feel like you have a bad cold or the flu. So who does walking pneumonia affect? Anyone can get walking pneumonia. You're more likely to get walking pneumonia if you are 2 or younger, 65 or older, have a weakened immune system, have chronic obstructive pulmonary disease, you have asthma, emphysema, live or work in crowded spaces such as schools, dormitories, nursing homes, military barracks, just to name a few areas. If you use tobacco products, and if you regularly use inhaled corticosteroids. So what are the first signs of walking pneumonia? When it seems like a cold is lasting longer than 7 to 10 days, especially if a cough is getting worse or not going away, it could be walking pneumonia. Symptoms can come on suddenly or take a longer to start. Symptoms include sore throat, extreme tiredness, chest pain or discomfort, low-grade fevers, mild chills, cough, sneezing, headaches, poor feeding in infants, loss of appetite in older kids, earache, and stomach pain. And the kids usually are the ones that are complaining about the earache and the stomach pains most of the time. So what causes it? Walking pneumonia cause may include bacteria, could be bacterial, could be from a virus, and it could be from molds or fungi. So is walking pneumonia contagious? Yes, it is very contagious. When someone who has walking pneumonia coughs, sneezes, talks, sings, or breathes near you, tiny droplets containing the disease enter the air. The illness spreads if you inhale those droplets. So how long am I contagious if I have walking pneumonia? If you have walking pneumonia, you're contagious for 2 to 4 weeks before symptoms appear. And that's called the incubation period. During the incubation period, you probably won't realize you're contagious and spreading walking pneumonia. Once the symptoms start, you are contagious until the symptoms end. So how is walking pneumonia diagnosed and treated? The doctor will conduct what's called a physical examination. That includes listening to your lungs. They'll ask you your symptoms, including how long you've had them. They may also ask whether any family, friends, co-workers, or other people around you regularly interact with, or any sick ones around you do they have similar symptoms. If the provider suspects you have walking pneumonia, they'll order tests to help confirm the diagnosis, such as a chest x-ray. They may also do some labs. Walking pneumonia treatments is going to depend on the cause. If a healthcare provider suspects that you have walking pneumonia and is caused bacteria, they may prescribe antibiotics. If the provider prescribes antibiotics, you be sure you finish the full course. Most people, bad habits. They'll take it when they feel better, they just completely stop. When you're feeling better, the antibiotic is now starting to work in your system, so you must finish the entire course of that antibiotic and don't share it or give it to anyone else. If you don't, the walking pneumonia may come back and be more difficult to treat. If you have walking pneumonia as a result of a virus or another cause, you have to let the illness run its course. A provider may recommend over-the-counter medications to help relieve the nasal congestion, the cough, the mucus buildup in your chest. You can help open your airways by drinking plenty of warm fluids, using a humidifier, or taking a hot bath or shower. If you have a fever, it's a good idea to drink more fluids and rest. Non-steroidal anti-inflammatory drugs can also help reduce your fever. Not everyone can take non-steroidal anti-inflammatory, so be sure that you can. And these are like your Motrins, your Aleve, like those things, okay? So it's a good idea to check with your provider before you take them because not everyone can take these. They can also cause bleeding, so be careful of that. So how can I prevent walking pneumonia from getting worse? You want to cover your nose and mouth with a tissue when you sneeze or cough. If the tissue isn't available, sneeze or cough inside your elbow. So you want to bend your elbow, bend your face, and you want to sneeze that way and cough that way. Okay, you want to regularly wash your hands with soap and clean water for at least 20 seconds, or to the song, Happy Birthday. If soap and clean water aren't available, use an alcohol-based hand sanitizer. You want to wear a mask around sick people if you have a respiratory condition like asthma. If you have a weakened immune system, you want to make sure that that person is also wearing something, okay? So let's talk about what I should eat or drink. I know many people, they like to go the natural way. So let's talk about that. So some foods you want to avoid is processed meats. According to studies, the nitrates used in the production and preservation of processed meats may cause inflammation and stress in your lungs. Alcohol can contain sulfites, which can exacerbate the symptoms of pneumonia. Sugary drinks. Consuming too much sugar may worsen inflammation and weaken your immune system. So foods also high in sodium, you want to try to avoid that. A diet rich in protein is beneficial for the people suffering from pneumonia. Foods like nuts, seeds, beans, white meat, cold water fishes like salmon and sardines, they have anti-inflammatory properties. They also are repairing the damaged tissue and building the new tissue in your body. Some vitamins that I've seen people take that you might want to try, vitamin C, probiotics, zinc, your Ds. I always talk about the Ds, the importance of Ds. A lot of us are lacking that. Ginseng, garlic. There's one called anti-V. There's a lot of vitamins out. If you go to a good vitamin store, they can go through that with you. If you're someone to prefer to go the natural way, but please note, if it's getting out of control, you must see a physician because it can get worse and become deadly. So some statistics. So according to the CDC, respiratory infections among young children have been on the rise since the school year began in August. There's a significant increase among all age groups. So all age groups are going into the hospital and being admitted with this. However, the increase is notably high since March and October among children ages 2 to 4 who are diagnosed. They grew from 1% to now 7.2% of children, according to the CDC. And children between ages 5 to 17, the percentage grew from 3.6 to 7.4%. That is a significant increase in this disease for the last 6 months. So please make sure that you're being mindful of that, okay? Of note, COVID-19, like walking pneumonia, is a respiratory illness, right? So people might think I have COVID-19. Do I have COVID-19? Well, it spreads through your respiratory droplets in the air and shares many of the same symptoms as walking pneumonia. So they both share similar symptoms. However, it may also cause muscle and body aches, loss of taste or smell, diarrhea, and nausea and vomiting. Remember, the most common cause of walking pneumonia is a type of bacteria, not necessarily a virus. Walking pneumonia is a common respiratory infection that many people may mistake for just a bad cold or flu, as I stated earlier. Because of this, many people don't seek treatment. You can manage many of your symptoms with over-the-counter medications, rest, and plenty of fluids. Still, it's a good idea, as I stated, to see a healthcare provider if you have signs and symptoms of walking pneumonia. Even if you think it's just a cold or flu, they can prescribe antibiotics that can help speed up your recovery. They can also answer any of your questions or concerns. Now, you should definitely go to the emergency room and call your doctor if you're coughing up dark brown or bloody mucus, have new or worse trouble breathing, you are dizzy or lightheaded, or you feel like you're going to faint a lot. So you want to get that checked out. Walking pneumonia symptoms usually depend on where the infection is concentrated. A child whose infection is in the top or the middle part of their lungs will probably have labored breathing. So you just want to make sure you're mindful of children that are in your home, going into daycares, going into schools. I'm not saying keep your kids from daycare and schools, please don't say that. But you want to be mindful that the fact that they're going to an environment that they can be exposed to when they come home. If you see these things, you want to get it checked out. Another whose infection is in the low, and if it's in the lower lungs near their belly, they may have breathing problems, but may have also an upset stomach, nausea, or vomiting. So when they're complaining of those things, you want to be mindful of that and just check it out, okay? So I want to give special acknowledgement to the CDC, kidshealth.org, Cleveland Clinic, and Mayo Clinic for the information that I provided you today. Please make sure that you're getting yourself checked. Please make sure you're taking your vitamins to stay hydrated. If you know you're infected or sick, I know we all would like to go into the sanctuary of the church, and the Bible says, forsake not the assembling of the saints. But if you are sick, please use wisdom, because God give us all wisdom, and do not go into the sanctuary, because you never know who has an immune system that cannot handle a lot of the infections that are going around now. God bless you. Thank you so much for your time and attention, and enjoy the rest of the service. Should you have any questions for me, please feel free to stick around and join us in the Zoom room immediately after service. God bless.